the vertebra which is segmented into typical and atypical ones. The typical ones which contains most of the features, the common most features, whereas atypical ones, sorry. Whereas atypical ones, the vertebra which may have additional feature or they may miss a common those features that is present on the typical one. So the typical vertebra which has the body which is the anterior one and which is roughly cylindrical, and posterior to it there is arch, the vertebral arch. This vertebral arch, as you have here in the picture, which forms the walls, the posterolaterals of the foramen, vertebral foramen wall. And there is also 7 processes that arise from the vertebral arch, Now, let's see the features of each component of the typical vertebra. Body, the vertebral body which is massive and which is responsible to bear the weight and which is linked together by fibrous types of cartilage which is intervertebral disc. Now this intervertebral disc is served as a medium of connecting the 2 vertebrae. So it forms a cartilaginous joint. And on the thoracic vertebra, there is an additional feature which is a facet that articulates with the heads of the vertebra, which is a costal facet, and the size of the vertebral body, which is increased downwards, which is related with the weights that bear on the individual vertebra, which is markedly the difference is visible starting from T4. Then the size of the vertebra will increase downwards towards the lumbar one and up to the sacrum. And the size of the sacrum, the first and the second one which is larger, and the inferior one which becomes smaller and forms a tips of the sacral the vertebral column. So the size of the vertebral body, which is related mainly with the weight of the body. Now the arch, the vertebral arch, which forms the posterolateral walls of the foramens, and which has segmented into the pedicles and the lamina. The pedicles, which is adhere on the posterior surface the body, whereas the lamina, which is found posterior to the pedicle, that fuse together and forms medially one process which is the spinous process. Totally, there are 7 processes which arise from the vertebral arch. Now, class line. Okay, sorry. Okay, the vertebral arch forms the vertebral foramina, and those vertebral foramina stack over the other and forms the vertebral canal. You know, we are saying a foramina, which is just a passage, a foramen that used for passage, or whereas a canal which has somewhat a longitudinal structure. So this vertebral canal is formed by combinations of a separate vertebral foramen, and those vertebral canal house the spinal cord and the nerve that arise from the spinal cord, which is the spinal nerve, and there is also a membrane that's how surrounds the spinal cord, which is the meninges. The meninges also found within the vertebral canals. In addition to that, there is a neurovascular structure which supplies the spinal cord and the meninges itself, still, which is found within the vertebral canals. These vertebral canals superiorly which communicate with the cranial cavity through the foramen magnum. The foramen magnum, which is the largest foramen that is found on the craniums. And this foramen is used for the existing site for a spinal. Now, this vertebral arch, which is composed of two structures, which is the pedicles and the lamina ones. The pedicles, which is the bony pillars, that attach on the posterior surface of the vertebra, and form the lateral walls of the vertebral foramens. Whereas the lamina, which forms the posterior parts, mostly the posterior part, the medial posterior parts of the walls of vertebral foramens. And when it's fused together, there is right and left lamina. When it's fused together and forms an elongation, which is spinous process, the spinous process. You see, here it is the pedicle that attach on the posterior surface of the body, and there is also a lamina. Together it forms the vertebral arch, and in between its junction there is a process that arises from it. For instance, this one is the superior articular process, and here it is the inferior articular process. And posterolaterally there is posterior transverse process, the transverse process. Those three processes arise at the point where the two parts of the vertebral arch are fused, and the lamina means which is a structure that is flat in their structure and which fuse medially, posteromedially, and gives one process which is ampere to one, which is spinous process, the spinous process. Then on the superior surface of the pedicle, there is a notch, which is the superior notch, and there is also inferior vertebral notch. And those notch when articulate with other vertebra, which forms a foramen. Which foramen is intervertebral foramen. This intervertebral foramen is used for the passage of the nerve, which is a spinal nerve. You see here, it is a spinal nerve that emanates from the vertebral canals, and which is responsible to supply the trunk and extremity parts of our body. Whereas the head and neck, especially the face and some parts of the neck, is supplied by a cranial nerve, the cranial nerve. Now, the other structure that arise from the typical vertebra is the process. There are seven processes. One ampere median spinous process, which is projected posteriorly and inferiorly, and which overlaps the bodies of the inferior vertebra. Most of the time, they overlap the bodies of the inferior vertebra. And this spinous process is most of the time which is used for the attachments of muscles and ligaments. There is also other process which is a transverse process that project from posterolaterally from the junctions of pedicle and the lamin. And this transverse process as well is used for the attachments of muscles. Whereas there is also other process which is an articular process which has a facet that's used to for articulations of the other vertebrae. In a single vertebra, there are 4 articular processes with a facet. Those articular process is articulated with the superior vertebra and the inferior ones. For instance, there is 2 superior articular process that articulate with the superior vertebra, whereas the inferior 2 ones articulate with inferior articular process, the inferior vertebra. And those articular process also determine the movements that occurred on the regions. The arrangements of and the size as well as the orientations of the facet that is found on the articular process is also vary from region to region, and that determines the degrees of movement and the types of movements that occur in each region. So primarily the degrees of movement and the types of movement is determined by the zygophysis surface. And on the pedicle there is a notch, vertebral notch. This vertebral notch which is an indentation in between the body and the articular process, Here it is. You see, this one is the lateral views of the vertebra. This one is an indentation, superior vertebral notch. This is just an indentation on the pedicles. This indentation is formed anteriorly by the vertebral body, whereas posteriorly, which is formed by the superior articular process. There is also inferior vertebral notch. This inferior vertebral notch is also formed by the vertebral ball, the inferior parts of the vertebral body, and posteriorly by the inferior articular facet, the inferior articular process. Then this notch is converted into foramen when the vertebrae are articulated with the other vertebra. This okay, sorry. Okay, sorry. This intervertebral notch and superior vertebral notch is converted into foramens, which is intervertebral foramens. This foramen is formed by the articulations of the two vertebrae, you see? And this foramen is used for the passage of a nerve, which is the spinal nerve. The spinal cord, which is found or located within the canals, which is the vertebral canals. The vertebral canal is formed by the junctions of the two or more vertebrae. Look, this ones shows the parts of the vertebra and their functions. For instance, the spinous process, the articular process, and the transverse process. They all used for the For instance, the spinous process and the transverse one, which is used for the attachments of muscles, and which serve as a levator for movement. A levator, movement. I mean, skeleton by itself is used as elevators, whereas when the skeletal muscles are contracted, they create a movement. That is why these muscles, this process are used as a movement. Whereas the articular process, of course, the orientation of the articular facet as well as the size of the articular facet is vary from region to region. So the angles of and the types of also vary. Generally, this articular process is used for restricting a movement. There is a flexion on the vertebral column, but the flexion is somewhat restricted. There is also flexion and extension, but those movements are restricted. They are restricted by this process. And this one is the canals, which is the vertebral canal, and which is primarily used for protecting the structure that is found inside it, which is the spinal cord and roots of the spinal nerve. So they are protected by the pedicle and the lamina, and anteriorly by the body. But the primary functions of the body is which receive the weights of the body, and they translate from the axial part to the lower at sacroiliac joint, the sacroiliac joint. Okay. This one shows the spinal cord that is found within the vertebral canals, and there is a nerve which exists from the intervertebral foramen, through the intervertebral foramen, which is the spinal nerve. Okay. Now let's continue to the regional characteristics of vertebra. The vertebrae, they vary from region to regions. We have segmented the vertebral columns into 5 regions. The upper one, which is the cervical vertebra, which contains 7 cervical vertebra. Next to that, or inferior to that, there is a thoracic vertebra, which is 12 in number. Next to that, there is a lumbar vertebra. Which has a massive body. The size of the bodies of the vertebra increased inferiorly, and which is visible on the lateral and the posterior, the anterior views of the vertebral column. And you see the size of the vertebra, the bodies of the vertebra is increased from superior to inferior. You see the L5, which has the highest body, and which receives the highest weights of our body. The weights of at this point and at this point is not equal, so that is why which is larger in size, and the weight is transferred at this point to the sacrum, and laterally on the sacrum there is a formation of sacroiliac joint with the iliac bone, with the hip bones. So they translate or transport the weight to the hip bone and to the inferior limb, to the lower extremity. So then the size becomes decreased. The size of the sacrums become decreased towards the tips of the coccyx, because the energy, the weight already transferred to the hip bones at the hipposacral joint, at the sacroiliac joint. Now let's see the characters of cervical vertebrae. There are seven separate vertebrae in the cervical vertebrae. And there is also intervertebral disc in between the vertebrae. but there is no intervertebral disc in the first and second vertebra, in the first and second cervical vertebra. Instead, there is odontoid process. Instead, there is odontoid process. And the size of the vertebrae, which is smaller, that reflect the size of the weight, the weight that bears. Generally, which the cervical vertebrae also segmented into typical and atypical one. Typical and atypical one. Now, the third to the sixth one is categorized under a typical one. That means they have a common features. They share a common. Most of their features are common. Whereas the first, the second, and the seventh ones is atypical because which has a unique features, or they miss some features that is found on the typical one. Now let's see the typical one. The typical ones on the spine, on the typical ones of the cervical vertebrae, the transverse process which is shorter, and there is also a foramen, transverse foramen. This transverse foramen is used for the passage of artery and vein. But the seventh one, the transverse process of the C7s, which is allowed only for the passage of vertebral vein rather than the artery. Whereas the spine here, which is shorter and bifid, is shorter as well as bifid. Again, the body, which is rectangular in their shape, and there is also a concavity structure from the superior view. The superior surface is concave, whereas the inferior view of the body, which is convex. And the vertebral foramen, which is more larger and triangular. The vertebral foramen, which is larger because which is related with the structure that is found within the foramen, which is the spinal cord. So the spinal cord here, which is larger. Of course, the spinal cord which has two enlargement, cervical enlargement and lumbar enlargement. So the cervical enlargement of the spinal cord, which is found within the cervical region. So that is why the vertebral foramens of the cervical vertebrae are larger, and which is highly related with the nerve that supplies the upper extremity. Whereas the size of the lumbars, the vertebral foramen in the lumbar region is also larger, which is also related with the nerve that supplies the lower extremity, because they form a plexus. To innervate the extremity in these two regions. So the vertebral foramen, which is larger to accommodate the larger size of the spinal cord. Now, the articular process. The articular process, which has the superior facet and the inferior facet, their orientation is somewhat different from the other one, and which reflects the types of movements that occur on these regions. For instance, on the superior facet, which is face backward and upward, whereas the inferior one is opposite. Let's see in picture. This one is the bodies of the cervical vertebrae, as you have seen here, which is rectangular, which is more wider from lateral to lateral, and which is smaller in size. This one is the transverse process. The transverse process, which has a transverse foramen or foramen transverse, which is used for the passage of vertebral vessels. together the artery and the vein except the seventh one. And on the tips of the transverse process there is also tubercle, the anterior and the posterior tubercle, which is used for the attachments of muscle and ligament, muscles and ligament. Then this one is the superior articular facet. Superior articular facet. You know, the articular process which is shorter, more shorter. And this one's the surface that lined by the cartilage, which is the articular facet, which is oblique and relatively horizontal, a plane-like surface, but which is face posteriorly, and the inferior one is the opposite one. Now let's see the foramen. The foramen which is larger and triangular. This one is the base of the triangle, and this one is the apex one. You see, and which house the larger size of the spinal cord. Larger size of the spinal cord. Whereas the spinous process, which is shorter and bifid one. Therefore, the cervical vertebrae 3, 4, 5, and 6 have this feature, have a common feature of those structures. Now let's continue to the typical one. I mean atypical one. The atypical one. That means the vertebra 1, 2, and the 7th ones are categorized under atypical. For instance, the C1, or which is also called atlas, which has no body total. There is no body in the atlas. So they are categorized under atypical because it misses the body. And there is spinous process. There is no spinous process as well on the C1. Rather, which is a ring-like circular bones. There is a posterior and anterior arch. Rather than body, there is a ring-like structure, and on its lateral part there is a lateral mass. You see, this one is a lateral mass. This lateral mass also contains an articular facet, that used to articulate with the condyle of occipital bone, and forms atlanto-occipital joint. Okay. And there is also tubercles on both anterior and posterior arch, which is the posterior tubercle and the anterior tubercle. Those tubercle is used for the attachments of muscles and ligaments. As well, there is also an additional facet on the interior surface of the anterior arch, which is used for the articulations of dens of C2 or odontoid process of C2. Now let's see the structure. You see, this one is a C1, the C1 vertebra, which is a ring-like appearance. There is a posterior and anterior arch. This arch, when joined or fused together, they gives a lateral mass. You see, this one is a lateral mass, and this lateral mass has an articular facet, superior and inferior articular facet. The inferior one is which is in opposite to this one, which is not visible here. So the superior articular facet is articulated with the condyles of occipital bone. The occipital bone which is the parts of the cranium. This one is the occipital bones, which has a condyle, occipital condyle lateral to the foramens, the foramen magnum. This one is the foramen magnum that continue with this foramen is continue with the vertebral canals, and the spinal cord which exists through these foramens from the distal part of the brainstem and continue to the vertebral canal. Then this one forms atlanto-occipital joint, the atlanto-occipital, the condyle, and the superior articular facet. Now there is also another articulation with C2. A C2. This one is a C2. The C2 has odontoid process. This one is the odontoid process of C2. Now this C2, this odontoid process of C2 is articulated with a ring-like appearance. With these ones. So, this one is completed and forms a ring-like appearance by the ligament, which is transverse ligament, the transverse ligament. So these odontoid processes are inserted through this ring-like appearance. So this one is the facet that receives the odontoid process. The odontoid process. Now let's continue to the C2. A C2. Let's describe it. I think this one is a C2. A C2. Still C2 is category. Hello. Hello. Someone? Okay. Okay. This one is a C2 vertebra, which is still categorized under atypical one, because which has an additional structure, which is odontoid process. This odontoid process, which is a thin or dense-like structure that articulate with C1. Therefore, which forms atlanto-axial joint. And this C2, it is also called axis. Otherwise, the other feature is almost the same with that of the typical one, which has a superior articular facet, and there is also a transverse process with its foramen, and the spinous process. Which is bifid and short, like that of the typical one. The main feature that make it atypical is the presence of this odontoid process. This odontoid process is embryologically they derive from the intervertebral disc that fused with the bodies of C2. So there is no intervertebral disc in between C2 and C1 rather than the odontoid. And those joints, which is called a pivot type of synovial joint, that allows a rotational movement. Okay. Now the other atypical cervical vertebrae is C7, which is also called vertebra prominens. Because which has longest spinous process, which is almost horizontally, they lie horizontal, and which is easily palpable, and serve as a landmark to find and locate those vertebrae. And the transverse process of C7, which is larger, but the foramen that is found on the transverse process which is shorter and only contains or transmits vertebral vein. There is no artery here. And the spinous process, the seventh ones, is used for the attachments of ligament, specifically ligamentum nuchae. Specifically, the apex of ligamentum nuchae are attached on the spinous process of C7. Now look, this one is the C7 ones. You see, this one is the transverse process, the transverse foramen, which is smaller when you compare with the typical ones. The typical ones, those are the typical cervical vertebrae, whereas this one is atypical. You see the foramen, which is narrow, more narrow, and used for only for the passage of uh, vein, vertebral vein. And the other feature that makes it atypical is the spinous process. The spinous process. The spinous process, which like almost horizontally, and which is more longer, You see, the other is bifid and shorter one. And those ones, C1 and C2, still they are categorized under atypical ones, because in C2 there is additional structure which is odontoid process, whereas in C1 there is no body totally, no body present here. Rather, there is posterior and anterior arch that fuse and forms a ring-like structure, Whereas the typical ones, C3, C4, C5, and C6, they have a common feature. Almost their feature are shared by each of them. For instance, the spinous process, which is shorter and bifid, the transverse process, which contains foramens, which is transverse foramen, and which used for the passage of vertebral vessels. Okay, they share a common feature. So they are categorized under atypical one, typical cervical vertebrae. Now let's continue to the thoracic vertebra. The thoracic vertebra. The thoracic vertebra, which lays the upper backs, and provide for the attachments of ribs, in addition to the other vertebra, which has a facet that articulate with tubercles and heads of the ribs. There are 12 ribs, and they are numbered from superior to inferior as T1, T2, and up to T12. This one is a T1, and which is T12, a T12 one. Of course, the transverse, the ribs are articulated with the transverse process of the thoracic vertebrae and the body, which makes it unique from the other one. Now let's see the features of the vertebrae, the thoracic vertebrae. The main identification feature, whether the given the given vertebrae, whether it's categorized under thoracic vertebra or cervicals, which is identified by the presence of a facet on its body and its transverse process for the articulations of the ribs. In addition to that, there is also other features that makes unique in the thoracic region. For instance, in the vertebral body, which is heart-shaped. The shapes of the body is heart-shaped, and which has a facet for the articulation of the heads of the ribs. And the foramens, the vertebral foramen, which is smaller than the cervical and the lumbar. Again, which is circular, whereas the vertebral foramen that is found on the cervical and the lumbar one, which is almost triangular in their shape. Then the transverse process, which is long and which extends posterolaterally, that used for the attachments of muscles, and which also contains a facet as well for the articulations of ribs of tubercles of the ribs. Specifically, this facet is found the ribs that is found up to T10s, but the T11 and 12s they have no or doesn't the facet or costal facet on its transverse process. Whereas articulation process, there is 4 articulation process, 2 superior articulation process, and 2 inferior articulation process. Those facets, the facet of this articular process, the superior one, which directly face posteriorly and somewhat lateral, whereas the inferior ones, which face anteriorly and medially. So they form interlocking to each other. So the arrangements of the facet is also determine the types of movement. So such types of arrangement allows slight rotational movement, primarily rotational movement. Whereas the spinous process, which is longer but which is highly slopy and which covers the inferior vertebral body. The inferior vertebral body, because which is longer and slopy downs to cover the posterior surface of the inferior vertebral body that is present inferiorly. You see, these ones from the lateral view, which is sharply downs, the spinous process, which is sharply downs, and this one is a transverse process, which contain the facet that articulate tubercles of the ribs. But this facet only found on the thoracic vertebra that is found superior to the inferior two. That means the 11 thoracic ones and the 12 ones doesn't have the transverse process facet on its transverse process. Sorry. Whereas the foramens, the vertebral foramens, which is circular one. Still, there is some variation on the thoracic vertebrae. For instance, the upper 4 thoracic vertebrae, which share some features of the cervical vertebrae. For instance, the body, the T1 has a complete superior costal facet. A complete superior costal facet for the first ribs, whereas the other has a dummy facet rather than complete. It is a dummy facet, and the inferior ones on the inferior margins of the body, there is inferior dummy facet that articulate with the secondary ribs. And still, the T9 up to T12, there is some features that's specifically found on the lumbar region. For instance, there is a mammillary process on the T12. And there is also tubercles on the axis. Tubercular that is similar to the accessory process that is found on the lumbar ones. And there is also mammillary process on the lumbar ones. It is also present on the T12. That makes almost similar words with the lumbar ones. And the T12, which has transitional characteristics. Therefore, there is a transitional tension because the superior parts of the vertebra, which has a characteristics of the thoracic, whereas the inferior parts of the vertebra that has the lumbar characteristics. That is the lumbar characteristics. For instance, um, there is no costal facet in its inferior parts of the vertebra that articulate with the ribs. Rather, the superior half of the T12 has the complete costal facets that articulate with the T12 ribs. The T12 ribs. Therefore, which is the most fractured vertebra, because there is attentions, transitional tensions, because both of the future that is found on the thorax and on the lumbar regions are found on the single vertebra. Those creates a tension, transitional tension that causes a most fractured vertebra. Now, articulations, modus of articulations of the ribs, the thoracic vertebra, specifically, which has three articulation sites from each side. One, the superior articular facet and the inferior articular facet, and the other is on the transverse process. Now, the two which is found on the body, This two articular facet is articulate with the heads of the ribs, whereas this one, the facet that is found on the transverse process, which is articulate with the articular process, the articular facet of tubercles of the ribs. Now, these ones, the facet that is found on the bodies of the vertebra, which is a dummy facet on the typical vertebra, thoracic vertebra. The facet that is found on the bodies of the vertebra, which is a dummy facet, That means that a single ribs articulates with the inferior articular facet of the superior vertebra and the superior articular dummy facet of the inferior one. You see, these ones, which is articulate with its corresponding vertebra, whereas the inferior one, which articulate with inferior ribs. You see, for instance, if it is thoracic vertebra 2, or you can say 4, this one is a thoracic vertebra, that articulates with it. Or in other words, if assume this one is T5, T5, and this one is T4. If this heads of ribs articulated at this point, this ribs is T4. That is corresponding with the superior one. Let's see this one. For instance, this just shows the articulations of ribs with that of the body. The articulations of ribs and the body. This one is ribs 5. So this one is which articulate with the inferior articular dummy facets of the inferior part and the superior part of the two consecutive vertebra, and this one is the 5th vertebra, whereas this one is the 6th one. You see, the inferior articular dummy facet of the vertebra articulate with its corresponding one. Okay. But Still, there is other vertebra that contain only a single facet, because all ribs are not articulate with the same fashion with that of the body. You know, upon the anterior attachments of the ribs is segmented into true ribs and false ribs. Likewise here, there is the same fashions of articulation with the bodies of the vertebra, For instance, the bodies of I mean the T1s ribs ones, which is articulated with a complete demifacet that is found on the bodies of vertebral one, thoracic vertebral one, and this one is a thoracic vertebra ones, which also contains a demifacet, that articulate with the secondary ribs 2. Therefore, ribs 2, which is articulated with the inferior articular facet of this vertebrae and the superior articular facet of the second one. The second one. But in this case, the T1 ribs is articulated only with a single vertebra, which is T1, because which contains a complete demifacet. I mean facet rather than demifacet means which is half or semi. You see, this one is a demifacet, whereas this one is a complete one, that articulates with the heads of the ribs. Whereas the tubercles of the ribs, its corresponding number is articulated with its transverse one, For instance, this one is a T1, the T1 transverse process, which is articulated with ribs 1. Now let's see the other vertebra, which is T10s, T11 and T12. Specifically T10s, which is only contains a complete one articular facet, like that of T1. Whereas the secondary ribs up to the nines ones, sometimes the nines also has a demifacet. There is superior and inferior demifacet. But here on the 10s, 11th, and 12th, there is only a single facet, complete facet that articulate with its corresponding ribs. And there is also a transverse costal facet. This transverse costal facet is articulated with its corresponding ribs. Now, on the 11th and 12th ones, there is no costal facet on the transverse one. But like that on the 10th ones, this contains a complete costal facet, a complete single costal facet on its body, that articulate with the heads of the ribs. But there is no articulation in between ribs. Transverse process of the ribs. Now let's continue to the lumbar one, lumbar vertebra. Okay, the lumbar vertebra, which forms the skeletons of the lower back, and which is the massive one, especially the L5 one, which is the largest vertebra that is found in our body. And like that of the thoracic vertebra, there is no facet on its body and its transverse process. As well, there is no foramen on its transverse process. But there is still other features that used to identify the specific vertebrae, whether it is a lumbar or not. For instance, the body which is a kidney shaped, and which is massive, that receives weight. And the foramen, the vertebral foramen, which is larger and triangular, but it is still somewhat lower than or smaller than the cervical vertebrae. The foramen of cervical vertebrae, which is more larger and triangular as well. On the transverse process, there is additional process which is accessory process. The accessory process. This process is found on the posterior surface of a transverse process, which is used for the attachment of deep back muscles. Whereas the articular process, which is like the place of the articular phrases aligned vertically, almost vertically. This allows a flexion and extension, as well as lateral flexions. And still here there is a mammillary process on the superior facet, on the basis of superior facet. Still, those mammillary process is used for the attachment of deep muscles, deep back muscles. Now, the spinous process, which is more shorter, rectangular, and projects horizontally. You see, which is more blunt and which is rectangular in their shape. When you are saying spinous process, which is a spine in their appearance, as you have experienced it from the upper thoracic vertebra, but here which is rectangular, which extends from the upper parts of the lamina to the inferior parts of the lamina. This one is the lamina. When you are saying the lamina, which is a sheet-like bone that forms the posterior walls of the vertebral foramen. You see, the vertebral foramen. So, which extends, in this case, the spinous process extends from the superior parts of the lamina to the inferior parts of the lamina, and which gives a rectangular in their appearance. Look, this one is the articular process, the superior articular process, but there is a difference in the alignment of the articular facet, you see, which is faced posteriorly, somewhat laterally, the superior one, which is medially. This one is somewhat faced medially, whereas the lateral one, which is inferiorly as well as laterally. So these types of joints primarily allow flexion and extension, but which prevents rotational movement. Now let's continue to the sacrum. A sacrum, which is a fused bones, which is triangular in their shape, and which is like inferior to the sacrum. The lumbar, which is composed of 5 separate vertebrae and fused together in adult. So they consider as a single vertebra. Which is triangular in their shape, and the base of the sacrum, which lies from the superior, whereas its apex faces to the inferiorly to the coccyx. And this sacrums also participate for the formations of pelvic girdle. The pelvic girdle, you know, pelvic girdle means it's a bony ring. As the name it tells, a bony ring. Posteriorly, the anterolateral parts of the girdle is formed by hip bone, whereas the posteriorly, which is completed by the sacrum ones. So which forms the posterior walls of the pelvic cavity, and which allow and provide for the attachment of muscles and ligaments in the regions as well, which used to provide strings for the pelvic cavity. Then these sacrams receive the weight from the lumbar ones and transmit the weight to the pelvic girdle. That means at the sacroiliac joint. And the sacrum, there is a minor difference in male and females. The sacrum, which is more wider laterally in female, whereas in male, which is somewhat narrow and more longer, and which is reflects the pelvic cavities of the two sexes. You know, the pelvic cavity, which is more wider in females, which is uh, which is made more wider by the contributions of the sacrum as well. Of course, the iliac bones also more wider in females, but generally, the pelvic cavity, the pelvics are more wider in females. It is by the combinations of the sacrum as well as the hip bones. Okay, the base of the sacrum, which face superiorly with a fifth lumbar vertebra that articulate with a fifth lumbar vertebra, which is formed by S1, and there is also superior articular process, that arise from the S1 lumbar vertebra 1 that articulates with L5, and this S1 or sacral promontory, which is more prominent anteriorly, and which serve as a landmark for obstetricians. They used this sacral promontory as a landmark. And then it is not. It's used for measure the diameter of pelvic cavity. One of the landmarks that used for measuring the interior surface of the pelvic cavity is used as a sacral promontory, which is more prominent in males than females. The male sacral promontory is more prominent and indented towards the pelvic cavity, whereas the female ones, the sacral promontory, which is not developed like that of the male and which is not more prominent and progenited towards the pelvic cavity. Now the apex of the sacrum, which face inferior with the sacral, with the coccyx ones, and which is taper, and which has an oval articulation facet that articulate with the coccyx ones. Look, this one is the anterior surface of the hip bone, the sacral bones, and inferiorly there is also coccyx one. This is the base of the sacrum, and this one is the apex of the sacrum, which is composed of 5 separate vertebrae, and which is fused in adult ones, and which is smooth in anterior view, but which is rough posteriorly. And this one is S1 that receives the weight from the lumbar vertebra, fifth lumbar vertebra, and they translate the weight to the hip bones at the sacroiliac joint. You know, these sacral bones laterally from both sides, which articulate with the hip bone, the right and left hip bones, and forms sacroiliac joint. That at this joint, This sacral bone transfers the weight to the hip bones and then to the inferior, to the lower extremity. So when as when the weights are already transferred to the hip bones, the size of the bones they become diminished, and inferior part of the vertebral column, that means the coccyx, which has not almost any contribution to receive the weight, especially in standing position. Rather, when you are sitting, it may receive some weight. It may receive some weight rather than, which is used for primarily for the attachments of muscle and ligaments of the specifically muscle that forms the pelvic cavity, the force of pelvic cavity. um, there is a foramina, sacral foramina, that allow for the existence of the primary rami of spinal nerve. It may be a posterior or the anterior primary rami. The anterior primary rami, which exists from the sacral exists and enter to the pelvic cavity through the anterior pelvic sacral foramina, and there is also posterior sacral foramina that used for the passage of the dorsal or the posterior primary rami. And superiorly, there is a sacral canal, which is a continuation of vertebral canal from the lumbar vertebra. And which contains the distal part of the terminal end of the spinal nerve, which is cauda equina. Within the sacral canals, there is cauda equina. You see, those are the foramina, the four anterior foramina that used for the passage of or existing of the anterior rami of spinal nerve. And posteriorly, there is a posterior sacral foramina. Then here on its superior view, there is a sacral canal. This sacral canal superiorly continues as a vertebral canal. Then these sacral canals, which contains the terminal ends of the spinal cord, that means cauda equina, which is a horse tail-like structure, and they gives a branch sacral spinal nerve. This sacral spinal nerve bifurcates into anterior and posterior primary rami. Then this anterior and posterior sacral rami, they exist through the anterior and the posterior. Okay. Sorry. Look this one. This one is the sacrum. Some parts of the sacrum, the superior parts of the sacrum, were removed, so it exposed the structure that is found within the sacral hiatus. This one is the sacral hiatus. Which is just found posterior to the bodies of the sacra. And which is cauda equina, which gives a nerve, sacral nerve. This one, the sacral spinal nerve. This sacral spinal nerve, which is divided into anterior and the posterior primary rami. This anterior posterior rami exists through those corresponding foramina. And they supplies the structure that associated within the pelvic cavity and the lower extremity as well, the anterior one, whereas the posterior one, we supplies the gluteal region as well as the back muscles, and which is also serve as a sensory one, the sensories of the back. Now let's see the surface. There is a structural difference on the pelvic and the pelvic means it's anterior and on the posterior surface of the sacrum. On the sacrum. Now the anterior on the anterior surface or on the pelvic surface of the sacrum, which is smooth and concave and which faces to the pelvic cavity. The pelvic cavity, as we have said before, which is the sacrum is formed by the fusions of 5 separate vertebrae, but in between them there is intervertebral disc. This intervertebral disc is fused at adult stage and forms a bone. But in adult stage, the points of fusions, the sites of fusions of the intervertebral disc with the other parts of the sacral bones is marked as a smooth ridge or line, which is visible at the anterior surface, And the fusions of this intervertebral disc is together with that of the bones is started at the age of 20, but ossification may not be ended up to the middle age. Now, this one is the ridge, a transverse ridge or line, which reflects the intervertebral disc, Now, and which is a smooth, the anterior surface is smooth, whereas the posterior one, which is a rough and convex one, Look this one. This one is the posterior surface of the sacrum, which is the superior articular facets. Which articulate with the inferior articular facet of the lumbar. The bones are fused. So there is a structure that is a remnant of those fused one, which forms a crust, a median crust, a longitudinal crust. The vertebra, the typical vertebra, there is body and vertebral arch, So from the posterior view, there is 7 process. The spinous process are medially and somewhat laterally. There is articular process, the superior and the inferior articular process, and more laterally there is a transverse process. But in the sacrums, those processes they fused together and forms a ridge or cristias, a longitudinal ridge. For instance, medially there is a medial crust, which is formed by a fusion of the spinous process, which is formed by the upper four sacral vertebrae. Sometimes it may be up to the third sacral vertebra. Whereas distally they failed to fuse. The fifth and the fourth one, they failed to fuse together and form a sacral hiatus, Then, somewhat lateral to the medial crust, there is a fusion of articular process. You see, here it is the levels of articular process, the superior and inferior articular process. They fuse together and forms intermediate crust, Whereas more laterally, this one is the transverse process. So when it fused together and forms the lateral crust, There is right and left lateral crust, and there is also right and left intermediate crust, but there is a single median crust. Therefore, there is five longitudinal ridge from the posterior surface of the sacrum. So, which gives a rough in their appearance. Then, in addition to that, there is also a foramen, as you have saying before, which is a posterior sacral foramina, which is used for the passage of used for the passage of posterior ramus of sacral spinal nerve. Sacral spinal nerve. Okay. Then you see this one is the articular surface. This articular surface is articulated with the hip bones. Articulated with the hip bone. And this one, which is articulated superiorly with L5, L5. Whereas inferiorly, which is the apex of the coccyx sacrum, which is articulated with the coccygeal bones or coccyx, there is horn-like projection. This one. This horn-like projection is served as an articulation or articular process, like this one. See, this articulate with the coccyx. The coccyx. Still, the coccyx has also corner or horn-like projections that articulates with the sacral part. Articulated with the sacral corner. Okay. Now let's see the hiatus. The hiatus. This hiatus, which is found on the inferior parts of the sacrum posteriorly, which is formed by affilarities of fusions of S5 and S4. S4. Sometimes S4, but most of the times fusions of lamina as well as the spinous process of S5. And this sacral hiatus is clinically important for the administrations of anesthesial chemicals, which is extradural or epidural anesthesia. Of course, the posterior sacral foramina is also used for extradural or epidural anesthesia, for giving epidural anesthesia. Look this one. This one is the sacral hiatus, which is formed by the non-fused parts of the laminas of S5 mostly, and sometimes it may the fourth one also included, and which is located by the index finger. This one is the distal parts, and the sacral corner, that means the horn-like projection, which serve as a landmark to find this sacral hiatus by the finger, by palpating it. This one is somewhat flesh structures, which is a flesh, whereas this one is rigid or bony in their structure. So you can easily palpate and locate the sacral hiatus by using this landmark, the tooth landmark. This one, the spinous process of the fourth one, the distal part of the sacral hiatus, and laterally the sacral corners. So in the flexed positions, the lateral flexed positions, which is more vulnerable, so you can administer the anesthesia for specifically during childbirth. Those transsacrals, epidural and caudal epidural anesthesia is applicable through sacral hiatus and posterior sacral foramen, the sacral that. But both of whether it is administered on the posterior sacral foramen or on the sacral hiatus, which is epidural, the anesthesia is delivered superior to or external to the dural matters, which is epidural anesthesia. The epidural anesthesia. Now let's continue to the coccyx case, which is commonly called tailbone. Okay. ይሰማችኋል? እየሰማችሁኝ ነው? ኦኬ Still, this one is a triangular bones, which is formed by a fusions of 3 up to 5 bones. But most of the times, we takes as the average one, and most of the people that have is a four fusions of subparacoccygeal vertebrae. And this one is, as you know, its common name is tail bones because it is a remnant of the caudal minus of the embryonic skeletons, which is a tail-like skeletons, Those skeletons in the embryo, which is present from 4 up to 8 weeks, But there is an remnants of after 8 weeks, which it disappear most of the part, but there is still remnants of these skeletons, embryonic skeletons, which is a coccyx, and which is in adults formed as a single triangular coccyx bones, which is formed by fusions of 3 up to 5 vertebrae. And this muscle, this bones is specifically used for attachments of muscles and ligament. Attachments of muscles of the gluteal region, the gluteus maximus. Muscles are attached on the coccyx ones. The anococcygeal ligament, and coccyx, levator ani. Those are muscles, coccyx and levator ani muscles. Muscles that forms a pelvic diaphragm. There is a pelvic diaphragm that forms the inferior floors of the pelvic cavity. So those muscles are attached on the coccyx. Because as we have said before, it is used primarily for the attachment of those muscles rather than receiving or supporting weight. Of course, which has a few contribution to receive a weight during sitting position. Now the coccyx, like that of the sacrum, which has the anterior and the posterior surface. The anterior surface means that the pelvic surface, which is concave and smooth. And posterior surface, there is on the posterior surface there is an articulation surface, especially, and a transverse process. This rudimentary articular process that articulate with the corners of the sacrum. And coccygeal vertebra, the ones, which is the superior ones, remember, which is formed a fusions of 3 up to 5 vertebrae. So the first coccygeal vertebra, which is abbreviated as C capital O1 and Roman number 1. Whereas the cervical one, capital C and number, followed by a number. Then this one is the largest ones, and it is a triangular, a broadest, and which is found superiorly, and which has a transverse process and articular process. The articular process, which is coccygeal cornea, that articulates with the sacral cornea. You see, this one is a C1s. Coccygeal ones, which has the transverse process. This one is a transverse process, and superiorly there is articular process. This articular process is articulated with the corners of the sacra. Okay. In most peoples, the numbers of vertebrae are 33. That means there is 7 cervicals, 12 thoracic, 5 lumbar, and 9 fused ones, a total of 33. But there is a variations in the numbers of vertebrae. variation in numbers of vertebrae, which individual may have a number of 32 or higher than the most that has, which may have 34 vertebrae. And those variations most of the time which is found on the lumbar region and sacral ones, in the lumbar and the sacral ones. The variations, the degrees of variations, which is vary from sex and race, as well as there is a factor, developmental factor. That developmental factor also contribute for the variations of number or fusions of a number. By the way, if the numbers of the vertebrae are lower most of the time, which wrongly or mistakenly fused, the two consecutive vertebrae mistakenly fused ones, the fused ones. For instance, such types of fusion is which is called abnormal fusions of vertebrae, and it may be sacralization or lumbarizations based upon the locations of fusions. It may be sacralizations if the first sacral vertebrae are fused together with that of the lumbar. They are called lumbarizations. Imagine the sacral vertebrae are fused together as there is a five sacral vertebrae. They fuse together as a single bone. But if the first sacral vertebrae are separated from the rest and fused with the lumbar ones, in this case, which is called lumbarizations, And this lumbarization is maybe complete and hemilumbarization. If the sacral vertebra are separated completely from the other groups of the sacrams and fused with that of the lumbar, that is called complete or general, simply lumbarizations. If it is partially, which is called hemilumbarization. The same is true in hemisacralization and sacralization. In the case of sacralizations, the L5s, the distal parts of the lumbar vertebrae, L5, which may be fused with that of the sacrum. If it is completely, they are called sacralization, or it is partially, it is called hemisacralization. So if it is fused, that diminishes the numbers of the separate vertebrae, Look, this one is the sacrum that has a sacralization of L5 vertebra. This one is the pelvic view. You see, which the L5, which is fused with that of the sacrum, which is fused completely, which is called sacralization, This one is the posterior view, and this one is lumbarizations. That means that the sacrams are the first sacral vertebra, which is separated from the rest of the sacrum, and that's fused superiorly with the lumbar vertebra. So this one is the four. Yes, it is the four, starting from S2 up to S5, whereas the S1 is lumbaralized with the lumbarization, or fused with the lumbar ones. Now the other thing during lumbarization, most of the times there is a shifting of ribs, For instance, in sacralization, that means in this case, in this type of sacralization, there is upward shifting of ribs. But that doesn't mean the thoracic ribs are decreased in their number. Rather, there is an additional ribs on the 7 cervical vertebrae. Look, this one is the normal one, the normal ones. So during sacralization, there is an additional cervical rudimentary ribs on the C1. But the reverse is true in the lumbar one. In the lumbar one, look this one. Still, there is a shifting of ribs downward or inferiorly to the lumbar regions. The lumbar region. Still, this one is the lumbar ribs is an additional ribs. There is 12 ribs in the thoracic region, and additionally, there is also ruminant lumbar ribs in the case of lumbarizations. In the case of lumbarization. So, uh, when you are applying clinically, those variations should be considered. And especially when you are locating the nerve that exists from the vertebral columns. They should to be considered, or to locate and find the vertebrae. They should keep in your mind there may be a fusions of vertebra. I think it is better to finish our lecture before lunch, and we release after for your lunch without a break, because we start and interrupted at the middle the lecture, so it is not necessary to give a rest or break here. So let's continue our discussion. So please give your attentions. Okay. The vertebral columns is not a straight like appearance, rather there is a curvature. This curvature are segmented into primary curvature and secondary curvature. The primary curvature, the curvature that is present before birth. Okay. Those primary curvatures, which is concave anteriorly and which is found on the thoracic and the sacral one. Whereas the secondary curvature, which is developed after birth, and which is found on the cervical and lumbar curvatures, which is concave posteriorly. Mind you, here it is developed after birth. Before birth, the positions of the fetus or the embryo, they have a single curvature. You see, this one is the fetus before birth. This one is a curvature that is found developed before birth, which is primary curvature. You know, the embryos are the positions of the fetus are in the flexed one. This makes to accommodate or increase the abdominopelvic cavity that accommodates the visceral organ within the pelvic cavity. Because this position is increase the pelvic cavity, the volumes of the pelvic cavity, to accommodate the pelvic visceral organ as well. And the rooms of the uterus, that does not allow for standing position. So the positions of the fetus are like this one, in flexed positions. Now after birth, they start to develop a secondary curvature. Look, this one, the green one, which is the lumbar one, and the neck region, the lumbar, and 4 years babies also they develop clearly the secondary curvature on the lumbar and cervical regions, which is in response to giving or maintaining the positions of our body and the movement that's occur in these regions. So they develop it after birth. Whereas the primary curvature, the thoracic curvature and the sacral curvature, which is present before birth, that is why it is called primary one, the primary. But there is also abnormal curvature, which is more exaggerated curvature, that is somewhat devoid from the normal curvature. Kyphosis or hunchback, which is the thoracic curvature is more exaggerated curved, which is related with osteoporosis, whereas the opposite curvatures of kyphosis is lordosis. Of course, this lordosis and kyphosis is occurred in different regions of the vertebral column. The kyphosis, which is majorly found or occurred on the thoracic regions, whereas the lordosis, which is occurred on the lumbar ones. In this case, this lordosis may occur temporarily on the pregnant women, as well on the obese ones. Of course, these ones most of the times is occur due to weakness of the muscle as well as osteomalacia of the bone, or which is not contain or accumulate enough mineral within the bones. If the bones is somewhat smooth or which is not enough strong, lordosis may develop. Whereas scoliosis, which is a lateral curvature, which is more exaggerated, which is abnormal, This is yes. Please make mood, and we'll finish, by the way, our discussions after the next slide. And we'll continue on tomorrow. We'll continue on the tomorrow session. Scoliosis, which is abnormal lateral curvature or deviations of the vertebral columns, which is created due to unequal growth of vertebral columns, which is due to pathologies. That means if the vertebral bodies are eroded pathologically from one side or from unequal sides, they form a lateral curvature. Even if there is a paralysis of vertebral columns, vertebral muscles from one side, there is an opposing muscle from the other side. Therefore, still this situation is also allow for a lateral curvature. This one is a lateral curvature scoliosis. Look, the vertebrae, which is devoid from the midline, more devoid from the midline. The other is kyphosis. Look, the thoracic vertebra, which is curved more exaggeratedly. Whereas this one, the lumbar region, which is the lordosis, still the vertebral column which is more curved. By the way, those curvatures may also apply a pressure on the nerve that exists from the intervertebral foramen. Okay, the intervertebral foramen. So there is a formation of pain, back pain. Back pains may also appear. Okay. Vertebral ligament. Vertebral ligament. Okay. There is a ligament that associates with the joint. I give a highlight, just a highlight, because you have some of the groups comes to the DR and will discuss the vertebral column, including the ligament. So let me give some highlights, and we'll continue starting from the vertebral ligament on tomorrow. Just to give a highlight, there is a ligament that interconnect the two consecutive vertebra, that enhance the strength and keep the stability of the vertebral column. The major ones, there is anterior and posterior longitudinal ligament. There is anterior and posterior longitudinal ligament. This anterior and posterior longitudinal ligament, which run from the sacrum, superior to the coccyx, I mean the cranial bones, the occipital bones. There is also ligamentum flavum. The ligamentum flavum. This ligamentum flavum is a ligament that connects the two consecutive lamina. You see? So this ligamentum flavum, which enhance and prevent excessive flexions of the vertebral column, The other is ligamentum nuchae and supraspinous ligament. As the name it indicates, the supraspinous ligament, the ligament that passes over the tips of the spinous process, which is starting from the sacrums up to C7. There is a spinous process which connect the tips of spinous process, and superior to the C7, there is a ligamentum nuchae, a continuation of supraspinous. This ligamentum nuchae, by the way, which is a triangular one, will show the ligamentum nuchae. And the other ligaments, the interspinous ligament and intertransverse ligament. As the name it tells, interspinous ligament, a ligament that is found in between the two consecutive or adjacent spinous process along its length. Look, there is supraspinous ligament. The supraspinous ligament, which passes over the tips of spinous process along the vertebral columns, whereas the interspinous process, which traverses along its length of the spinous process itself, and that join to the other adjacent spinous process. The same is true intertransverse ligament. This intertransverse ligament, which connects the two adjacent transverse process of the vertebrae. Of course, those ligaments is associated with joint that strengthens and give more stability for the joint. We will see the joint in our tomorrow's sessions, but for now, let me show the ligament highlight, because you will discuss afternoon in DR. Look, the anterior longitudinal ligament. The anterior longitudinal ligament, which runs from the sacrum, starting from the sacrum, and which extends to the foramen magnum. That is within the cranial bone, occipital bone, okay, which lies the anterior parts of the body and the intervertebral disc. Imagine This anterior longitudinal ligament is primarily used to prevent excessive extension with that of the zygosphezial joint. The zygosphezial joint. We'll see the joint in next sessions. And there is also posterior longitudinal ligament. Look, this posterior longitudinal ligament is found within the vertebral canals. That cover the posterior surface of the body, the vertebral body, as well as the disc, still, which is extended from the sacrum to the foramen magnum, and the other vertebra, the other ligaments are ligamentum nuchae, which is upward extensions of supraspinous ligament, the supraspinous ligament. You know, the supraspinous ligament, which extends from the sacrums over the apex or the tips of each vertebrae up to C7. Then this supraspinous ligament continues as ligamentum nuchae superior to C7, and which extends up to the coccyx zone, to the external occipital protuberance, and to the margins of the foramen magnum. You know, this ligamentum nuchae, which is a inverted triangular shape, sheets of membranes, which is strong. Its bases are extended from the margins of foramen magnum to the external occipital protuberance, and its apex is ended at the C7, the spinous process of C7. Okay. Therefore, these ones as well, those ligaments, the supraspinous and ligamentum nuchae, is prevent excessive flexion. Okay, excessive flexions. Okay, tomorrow we'll continue the detail of those parts, ligaments, joint, as well as musculature and neurovascular structures of the body. So for now, it is better to stop here. If you have any questions, you can raise your hand, and I will give a chance.